I think what focusing on patient experience does is it reminds us that delivering great health and social care is about people. And if you're not thinking about people's experiences, whether it's those that need the service or those that work to deliver it, you're missing a huge element of what good quality looks like. So we're very good, and we need to obviously focus on clinical effectiveness, so excellence in the clinical framework, and on safety, because if we don't have those two things, then we're not doing very well at all. But there's that third element that says cares about people experiencing their care and being engaged with it. It's critical to delivering high quality care. And that construct that we call person-centered care takes into account all three things, putting people at the heart of it, whether, and bringing together that perspective of staff and of care users. I think it's simple to see it through somebody else's eyes, to walk in their shoes. If you want a marker for quality, most other industries would tell you look at customer experience. The customer in a healthcare setting is the patient. But they would secondary argue, if I want to deliver great customer experience, I need great staff experience. And healthcare's lagged behind in its thinking about how to employ that to deliver the best quality care. So the value is, I know what I think I'm doing, and all the effort I'm expending as an individual, as an organisation and as a system is delivering what's required from the people that need to use it. And it's doing it in a way that's sustainable and appropriate and enjoyable for the people that are working within it. And that's what the experience element gives us the power to unlock. I probably have to argue no. And you probably hear this quite a lot. And I think that's because we use the word systems in the question. I think that's the biggest challenge. I think if you ask about individuals, if you ask about individual organisations or particular areas of care within a system, the answer would probably be very different. There's lots of yeses in there, which is fantastic. But we've yet to prove our understanding of and our ability to join all that together in a system that delivers holistically person-centred care and therefore improved quality. But there's a growing appetite to do so. From days like today, all over the world, it's World Patient Experience Week this week. Now, who'd have thought that phenomenon would be around a few years ago? But it is. And it might sound a little trite, but as a phenomenon to be there, it means it's now entering people's psyches. And that's one of the first steps you need to take a system-wide change, is that it's accepted as something we need to do. And I think there's still a big gap between types of people and the way in which they accept it. So there's a way in which one might want to engage with medical professionals and consultants and clinicians on the patient experience agenda versus how you'd engage with policymakers. I think respecting them in the same way that you'd respect the patient in this process is key to unlocking the system answer. Understanding how you get the information you need in a way that's actionable and how you get it to the right people. And those right people aren't just caregivers, they're the care recipients themselves. So it's creating and sustaining partnerships, but whilst doing it, creating evaluation and measurement that allows you to trust what you're doing is making a difference. And creating that information in a way that's digestible by different audiences. So there's information that's digestible, appealing and trustworthy to a clinician as much as it is to a patient or a family member or a frontline ward sister in a hospital. And sort of bringing all those things together is quite complicated. But if we focus on that singular goal of what matters most to patients and families and staff, then it becomes less complicated. So as always, it's probably more about communication than anything else. I think from Picker's point of view, we embrace the fact that people are really taking this on. Picker's a charity that only exists for this reason. It's the reason we've been around for 20 odd years now. But I would just put that word of advice in to say it doesn't have to be the silver bullet, that you can start small and you can start very focused and very targeted and grow the skills, grow the thinking and grow the processes you need to then grow out to organisation, to system and to full evolution in terms of your way you think. I think if you don't engage people at that level, it gets lost very quickly and it becomes another initiative that can be burned out quite quickly. A friend of mine always says the Sahara Desert is made up of individual grains of sand despite being the Sahara Desert. And there's that philosophy to it, that those individual elements are equally important to creating that overall entity, and not to forget that when we get very excited about talking about policy and system change, is that it's the people on the ground that use the services and the people delivering them day in, day out that are going to need to deliver those changes in reality.